I'm Jessica. I'm a student nurse at Fayetteville State Community College, and I heard you got nursing school and you needed a physical assessment done. Is that right?
Yes.
Okay. Well, I'm going to be pressing on you in a few places, listening to you, and making you do a few things. Is that okay?
Yes.
Okay. Well, patient is fully draped, the curtain is closed, door is shut, and I'm going to perform hand hygiene. Can you tell me your name and date of birth?
Callie Allen, 02-1802.
Okay. Can you tell me where you're at?
Fayetteville Hospital.
Can you tell me who the president is?
Donald Trump.
And what is today's date?
Monday, April 6th.
Okay. So patient is alert and oriented times, I'd say 8. She's oriented to time and place, and she doesn't seem like she's in any distress. Her hygiene seems good. Her mood is pleasant. And are you in any pain right now?
No.
Okay. So now I'm going to be palpating her scalp, and I'm feeling for any masses, any tenderness. Hair distribution is good. Symmetry is good. And I'm also looking at the symmetry of her eyes and ears and everything. And now I'm feeling for temperature. I'm also looking for skin color, and it looks normal for ethnicity. Okay. And I'm also going to be looking at her eyes. So I'm going to get you to look straight ahead at the wall.
Okay.
And I'm going to shine this light in your eyes. Okay. And I'm going to get you to look at my pen, and I'm going to bring it into your face. Okay. And I'm also going to be pulling down your eyelids. I'm going to look at your conjunctiva. And it's pink and moist. There's no drainage. There's no lesions. And her sclera is white. And I'm also going to be testing for symmetry of eye movements. I'm going to get you to watch my pen. And I'm going to move it. And don't move your head. Okay, I'm also going to be checking her temporal pulses. And I'll say they're 2+ bilaterally. And I'm also going to be looking in her ears. There's no drainage. Are they tender anywhere?
No.
Okay. I'm looking in this one. Any tenderness?
No.
Okay. And I'm also going to be looking in her nose. The mucosa is okay. It's pink. No drainage. Can you patency is good on both sides. I'm going to get you to open your mouth and say ah. Ah. Her palate is good. Tonsils look good. Uvula. Teeth are in good condition. Everything's moist and pink. I'm going to get you to smile, frown, puff out your cheeks, maybe stick out your tongue, move it side to side. And so her eyes are checking for optic nerve, which is 2, and also 3, 4, and 6 for her movements. Her ears was cranial nerve 8, her nose was 1, and her puffing out her cheeks was 7. And I'm also going to perform the whisper test. Forgot about it. I'm going to get you to cover your right ear. I'm going to get you to repeat the word back that I say to you.
Ball.
Cover your left ear.
Girl.
Okay, so her whisper test is good. And now I'm going to go down to her neck. And first I'm going to palpate for any lymph nodes. Okay, and I'm also going to check for skin turgor, immediate recoil, and I'm also checking to make sure her trachea is midline. Now I'm going to do, and can you do your range of motion of your neck? Okay, and that's good. So now I'm going to listen to her lung sounds. I'm going to start at the back, and there's 10 places I'll listen to. And I'll listen for a full inspiration and expiration. And I'll also listen to 2 laterally. I'm also going to uncover from the front and expose her some, and I'm going to listen to the 8 on the front. Starting at the second intercostal space. And I notice her posture is erect, and also there's no work of breathing. I'm going to cover her back up. And now I'm going to look at your arms. And first I'm going to check her pulses, brachial pulses. 2 plus bilaterally, and I'll also check her radial. And they're also 2 plus bilaterally. I'm checking for temperature is good, no lesions, moisture, no edema. And I'm also going to be checking her capillary refill. And it's 3 seconds or less. I'm also checking her nail bed angle and the color of it, and it's normal. I'm going to get you to squeeze my fingers, push against my hands, pull them towards you. I'm also going to get you to do your range of motion. So put your arm across, reach back, and scratch your back. And same thing with the other side. Okay. And I forgot on her lungs, I'm going to check the symmetry of her lung expansion. So I'm going to get her to take a deep breath. And I'll watch my fingers move away from each other. And I'll also do it anteriorly on the front to make sure it's symmetrical. And now I'm going to listen to her cardiac sounds. So I'm going to uncover her again. And I'm going to start on the right side, second intercostal space, listening to her aortic, her pulmonary, Erb's point, tricuspid, mitral, and also apical. And I'm listening for S1 and S2 sounds. And her rhythm is good. I'm going to cover you back up. I'm going to get you to lay down for me. And I'm going to uncover her again. Are you in any pain anywhere?
No.
Okay. And I'll auscultate all 4 quadrants. Next, I'll palpate each one for any firmness or tenderness. Are you in any pain anywhere? No. I'm also looking for her contour and it's flat. I'm looking for any horizontal pulsations. And there's none noted. I'm going to cover you back up. I'm going to get you to sit up for me. And I'm going to be checking her lower extremities. I'm also checking this for temperature, skin, or hair distribution, color, any edema, any lesions, and there's none noted. I'm going to check her patellar reflexes. If I had a hammer, I would do that. I'm also going to check for her range of motion. Can you move your ankles for me? Okay. I'm going to get you to push up on my hands. And this is checking her strength. I'm also going to check her capillary fill in each foot. And I'd say it's 3 seconds or less. I'm checking her pedal pulses. And they're 2 plus bilaterally. I'm also going to check her gait. So I'm going to get you to walk. Walk back. And I believe that's it.